Hello, I'm Jason Harrington, President and CEO here at Lakes Regional Healthcare in Spirit Lake. I wanted to provide an update to you, as you probably have heard by now, either through our press release or through the state or through a video from Dr. Boris last night, that Dickinson County in our service area has had its first positive COVID-19 case. And we've been working on our COVID-19 response for, it seems like a couple of months now, but at least the last month. And so as we get to the different stages of having a confirmed case and the potential spread of the virus, there are certain steps that we have to take further in order to protect our patients and staff and all of you in the community. And one of those, which we'll implement on Monday, is what we're calling a no visitor restriction. So right now, unless you're coming here as a patient, and even then, we're trying to see patients in a different way. Unless you're really, really sick, we're trying to postpone visits and otherwise that keep people out of Lakes Regional Healthcare for your safety and for that of our patients and staff. So we had limited visitors access prior. We're going to limit that further come Monday and refer to it as a no visitor restriction. And essentially what that means is that we won't accept visitors with two real exceptions. If you have a family member who's on hospice, we'll allow limited visiting for hospice patients. If you're an expectant mother who has a birthing coach or a partner or otherwise, we would allow those people to be part of the delivery process. Outside of those two instances, we would not be allowing visitors to the campus, and so I want to make everyone aware that effective Monday that will go into effect. During that time, we'll really encourage family members and others to connect with their family member via technology and other means, sharing pictures and those types of things. Our nursing staff or a member of our care team will be reaching out to the family with updates about the patient's condition and otherwise. So this is really to protect our patients, to protect our staff, and to protect others from being exposed to anything that they would not want to be. The other thing I thought I would mention as I was driving in today, I noticed, and I'm usually very excited about this, but I noticed that the ice was out on east and it's going out on west, and I've talked to a number of plumbers in the area that have opened up homes. And so I know it's getting to be that time of year where we're welcoming our summer family, our summer residents back. And I know probably a number of people are thinking, well, if I'm quarantined and practicing social distancing anyway, I'd probably rather be up at the lake than somewhere else. And although I appreciate the excitement in that, most people that are coming back have traveled elsewhere, probably a number of them on airplanes, out of state, out of the country, and otherwise. And as a result of that, my ask of you is, if you fall into that, when you first come back home, if you could make every attempt to isolate yourself or self-quarantine for the first 14 days. Quite honestly, we do that with staff that fall into any of that category. If you've been traveling on a plane, out of state, we keep you off work for 14 days because that's about the incubation period for COVID-19. So we would ask that you do the same for your own safety, for the safety of the community and otherwise. There are a number of sites that will deliver groceries if you have family members or friends or otherwise that could even get your groceries for you. I would even encourage that. So again, enjoy some solitude when you come back, and if you could spend those first 14 days isolating yourself, getting your house open, and spending some time with family, that might be preferred. So just wanted to share that with you as my own observation. We're excited to have you back. Thanks to everybody in the community that have offered support, personal protective equipment, people who are sewing masks, and otherwise we are grateful. We are also grateful, I think every day I get somebody saying that they're praying for us and our staff, for our safety and continued ability to care for you all in the community. And we're proud to do that and thankful for all of that support. So thank you for your attention to this, and I greatly appreciate it.